Hey guys, welcome back to the WODdoc Project 365, episode 1072. Guys, you're following along on YouTube, please jump on over to WODdoc.com. Check out all of our full-length videos. That's where we house them. What we're talking about today is knee pain and a way that we can self-mobilize our kneecaps to help or possibly reduce knee pain, okay? Keep in mind that whenever you're working with a kneecap, make sure that you are working inside your tolerances because there's a possibility that we can get knee dislocations or anything like that. However slight, it is important that I tell you, not that I think you're going to do it, but the disclaimer's out there for you. So this is called the star pattern of your knee. So kneecap mobility has a lot to do with how the tracking of the kneecap or patella works, and it's really important that we have mobility both medially and laterally and inferiorly and superiorly, right? So inferiorly or superiorly. So what we're going to try to do here is we're going to take both of our fingers, kind of form like a pincer grip here. If you have to, you can kind of use your web contact of your thumb and forefinger. That works as well. And we want to think about doing is making a cross going from lateral to medial. And you'll notice that I'm basically just taking up tension and I'm just adding a little bit of mobilization. It's very subtle. I'm not trying to rip my kneecap towards the inside of my knee. All right, just gathering that slack and then just giving a little bit of a press. So I want you to think about 3 presses. 1, 2, 3. I'm going to do the same thing in the opposite direction, right? So the first contact I showed you was like with the web. I can also do it just with a little bit of a pincer grip, or I can use 3 fingers as that. It's same thing. But what I'm going to do is I'm going to gather the fascial tension and I'm just going to push to the outside. Be careful when you go to the outside because this is the way that you can dislocate your knees, but it's very improbable as long as you do it with some gentle caressness, okay? After that, we're going to do the same thing, except now we're going to take both hands, 1 thumb, 1 forefinger. We're going to gather that tissue slack and we're going to press it downwards, right? We're just going to mobilize 3 times in that direction. From right there, we're going to gather the tissue slack and we're going to mobilize from inferior to superior, right? Once we do the cross, okay, now we're going to do the star. So I'm going to go crisscross. I'm going to go medial inferior. I'm going to go lateral inferior. I'm going to go medial superior. I'm going to go lateral superior, right? So that's the 4 ways, 6 ways. We're going to go superior to inferior, inferior to superior. We're going to go lateral to medial, medial to lateral, lateral to medial, and then we're going to crisscross those 3 directions. 3 little mobilizations in each direction. Make sure that kneecap is working how it should, okay? Questions, comments, please post them below. And until tomorrow, we're optimizing function to optimize performance.